Assalamu alaikum. My name is Dr. Huda Asif. I am a consultant gynecologist. Today I am going to give you a lecture on the female reproductive system, and it is a very important topic and the most neglected topic as well. So in today's present topic, I will tell you about the important MCQs which are being normally discussed and asked in the MCQ paper, and will tell you some about the how to implement this anatomy to ace the case of uterovaginal prolapse. As we all know, in female reproductive system there are external genitalia and the internal reproductive organs. The external genitalia is composed of mons pubis, labium majora, labium minora, vestibule, and the internal reproductive organs have the vagina, uterus, cervix, fallopian tubes, and the ovary. First of all, we will discuss the vagina. Vagina is a fibromuscular canal, and it has the anterior wall and the posterior wall. The most important thing which is normally asked about the vagina is that the anterior wall of the vagina is short. It is 7 centimeters in length, and the posterior wall is long. It is 9 centimeters in length. The vaginal walls, they are closely opposed to each other except at the cervix, and it has four fornices: the anterior, posterior, and the two lateral fornices. Regarding the histology of the vagina, it has the stratified squamous epithelium, and epithelium is very rich in glycogen, and due to the effects of estrogen, the glycogen is in the cells. A very important point which is normally asked, that vagina has no glands, then how the vagina is kept moist? The vagina is kept moist by the secretions of the cervical glands. And another next very important question is the how vaginal epithelium is kept at 4.5 pH. You must know that the Doderlein's bacillus, these are the normal commensal organism vaginal flora, and they convert the glycogen into lactic acid, and the lactic acid keeps the pH 4.5, and it has the protective role against the infections. And the relations of the vagina, that anteriorly the base of the bladder, laterally there is cardinal ligaments. The upper part of the vagina, that is supported by the cardinal ligaments and the uterosacral ligaments. Both these ligaments, they are very important support in supporting the pelvic viscera, and the clinical implication is that the level 1 support of the or viscera is because of the uterus is because of cardinal ligaments and the uterosacral ligaments. If this support is loosened, then the uterovaginal prolapse occurs. The next very important MCQ: what is the pH of the vagina at birth? At birth it is 7. Why it is 7? Because of lack of estrogen. If there is lack of estrogen, there will be decreased glycogen in the cells, and there will be decreased lactic acid formation, and hence the pH is 7. And other MCQs, that the pH of the vagina at puberty is 4.5. Why it is 4.5? Due to estrogen. As I told already, that the glycogen is converted into lactic acid, and the pH is kept at 4.5. So that was all about the vagina. So a short summary, that in vagina, you should know about the lengths of the anterior and the posterior walls. You should know how many fornices are there, what is the support of the vagina, and what is the histology. And most important MCQ, they are normally which is asked in the MCQ paper, is the pH of the vagina, that is 4.5. Why it is 4.5? Due to effect of due to lactic acid, which is formed by the effect by the vaginal flora that converts glycogen into the lactic acid. And why at puberty the pH goes to 4.5? Because of the effects of estrogen. There is increased glycogen and increased lactic acid. So that is all about the vagina. And next we will discuss the uterus. The uterus, it has the corpus. This is the corpus. It is also called the body of the uterus. It has cornual ends. It has isthmus, and it has the fundus. The fundus is the part above the cornua. This is the cornua, and cornua is the part where the fallopian tube is inserted into the uterus. The part of the uterus above the cornua is the fundus, and this is all the body or the corpus. The most constricted part of the uterus, that is called isthmus, and this is the cervix. The anatomical os, it is a point where the isthmus joins with the cervix. This is the isthmus, this is the cervix, and this is the point of anatomical os. Normally it is asked what is the length. You should know about the length, width, and thickness of the uterus. It is 7.5 centimeters long, 5 centimeter wide, and 3 centimeter thick. Although it is difficult to learn, but it is very important clinically, as when you are going to do a pelvic scan of a patient and measure the uterus, then it is important at that point that if patient has the uterus 7.5 centimeter long and it is 5 centimeter wide and 3 centimeter thick, then you label it as normal uterus, because in peripheries or in many setups they tell that it's a bulky uterus. So you should know actually the proper length and width and thickness of the uterus before labeling it bulky or enlarged uterus or this one. So it is important clinically. The weight of the uterus is 70 grams. The position of the uterus, it is antiversion, antiflexed, and 20% of the uterus, that is retroverted and retroflexed. Now there are many can be normal in the patient. 20% as in 20% of the patient it is present normally, but it can occur due to some pathologies, like in some endometriosis, if there is fibrosis, if posteriorly, then retroverted fixed uterus, that can be a diagnostic feature of endometriosis. So up till now we have discussed about the vagina and uterus, and in the last of my lecture I will discuss the blood supply and lymphatic drainage of all the viscera. The next is cervix. The length of the cervix is 2.5 centimeters, that is written in 10 teachers, but 2.5 to 3 centimeters, that is considered normal. And you should know the anatomy of the cervix, that it has the internal os, external os, and it is a point, a squamous-columnar junction, or this is the point where is normally the pathological changes, it occurs in the cervix. Parametrium, it is covered with the tissue that is called parametrium, that surrounds, which I have colored it yellow. It is the parametrium of the uterus. A very important thing in the lecture is that you should know about the course of the ureter. So the ureter, it has some relationship with the cervix, and the ureter, it runs 1 centimeter lateral to the supravaginal cervix, that is the vagina, and this is the supravaginal cervix. It runs 1 centimeter lateral to the supravaginal cervix within the parametrium. Next, the relations of cervix. Anteriorly it lies the bladder, some part of the urethra. Posteriorly there is a pouch of Douglas. Posteriorly lies the pouch of Douglas. Histology, we will discuss about the histology of the cervix. It is very important because in SIN and cervical carcinoma there is a change in the cervical histology resulting in SIN. So the endocervix and the ectocervix. Endocervix, it the upper 2/3 of the endocervix, it has a ciliated columnar epithelium, and ectocervix, as you all know that the ectocervix is in continuation with the vagina and it is exposed to the environment, so it is stratified squamous epithelium. And at the junction of endocervix and the ectocervix, there is squamocolumnar junction. Clinical implication is that the squamocolumnar junction is the site of future cervical carcinoma. It is very important. MCQ both in the IMM and in FCPS.